What's up, Burst TV? I'm Jessica, and I'm coming at you hot today. I don't have a lick of makeup on. It's for a reason. I wanted to go over head and neck, skin cancers, cancers of the mouth. And if you're a clinician watching this, I really hope this spurs you on to screen your patients, take the extra 2 or 3 minutes and provide this service to them. And if you're a patient, it's great for you to kind of get familiar with a screening process that you can screen yourself at home, bring it up to your doctors and your hygienist and of course, dermatologists at any point if you find something. Prevention is key here, early detection is key here, and so if I can provide any little bit of information or take-home message today, then we're doing the right thing. The other thing about this is most of my tips are going to be anti-aging, and who doesn't want to save a few wrinkles and crow's feet and some forehead stuff and stay looking young and fresh. So a little bit of my story with head and neck is I got diagnosed with vitiligo when I was young, and it's right here. It's a spot that doesn't have any pigment. I have it on my chin and a little on my neck, and I think it kind of goes around to the back. And when I got that, I didn't know what it was. It means I have no melanin there, and that's where our skin gets darker and protects us naturally from the sun so we don't get sunburnt, that kind of thing. So I don't have that. So guess what this does? It gets fried if I don't take care of it. And honestly, anything from your mouth down, basal cells and squamous cells are really, really common in this area. So I'm just extra cautious with my patch, and it's made me obviously take care of my whole skin and my head and neck a lot more. I look like a freak outside at the beach, I'm not gonna lie. But when you're screening yourself, you always are going to try to find lesions typically that are not uniformed. They're not in like a nice little circle like a freckle would be. They're typically colors when you're looking inside your mouth. They're red, white, or blue, and they last longer than a couple of weeks. Our skin and the tissues of our mouth typically turn over after a couple of weeks in healing. So if something's not healing or oozing, that's probably an indication that you need to get that checked out, that it's probably something a little bit more serious. So on your head and neck, you're gonna start by even just kind of feeling really softly and looking. Tops of the ears are really, really common. If you think about sun damage, the sun's coming from the top down. So tops of the ears, your nose, like I said, your lip, hairlines. I don't know how many, especially men that I see that get little spots here. And actually I had one several years ago, and I don't even know what it was called. They just called it some kind of keratosis, some kind of barnacle or something like that. I was like, okay, great. I've got barnacles like a pirate ship. But anyways, so spray these with sunscreen and do some extra protection. But start looking, have your spouse look, check the back of your neck, and you can feel down through your neck, your soft tissues here. You can feel a little bit harder and grab some of the muscles of your neck. Obviously, as clinicians, we know what this is called. But then you can swallow and kind of feel if your throat is enlarged. So many Americans are on thyroid medicine. And so sometimes you can catch maybe if your thyroid's enlarged or a little nodule on it. But if you ever feel something that doesn't feel normal or is tender or sore, please, alert your caregivers. Once you've checked out your head and neck on the outside, then you want to look on the inside of your mouth. You want to make sure and get a flashlight so that you can see really well. You're going to look at your cheeks on the inside. You're going to pull your lip down and up. You're going to stick out your tongue. You're going to look in your soft palate. You're going to look on both sides of your tongue towards the back especially. Right along there is where we see lots of lesions that are not typically good. The floor of your mouth, and you can kind of even feel, back to the outside, you can kind of even feel sometimes if you have some lymph nodes underneath here. Again, if they're tender, you could have something as simple as a sinus infection and you're just draining. But if it's something that, lasts longer than your sinus infection, you may want to get it checked out. You also need to take into consideration some risk factors. Alcohol and smoking, those have been typically the most risk factor, but recently HPV has become a bigger risk factor for oral cancer than the other risk factors. So no one's really excluded in this anymore, because teenagers and young children, they don't smoke or drink typically, but HPV, you know, most of us carry that. I think it's like 80 or 85% of us carry that virus. So those are just my tips for how to screen, what to screen for, and where to screen. So now I'm going to teach you some anti-aging things. So again, like I said, I don't have any pigment on my face. This is one of my favorite products. It's called, I don't work for this company, it's called Society. I've used it for umpteen years. And it's a prime and defense. So it's a little pigmented too, I kind of like it. So as I apply this on my face, it's a sunscreen. I just use really light pressure so I don't cause any more wrinkles doing it. It's a sunscreen, but it also, it primes for my makeup, and it makes my makeup really smooth and makes it stay on, and it's a really good product and product tip. The other thing that I do for my morning routine when I get ready is, it's great to have some kind of Spf Chapstick. There's a gazillion brands out there. This one's from my grocery store, and this is SPF 30. Burt's is a favorite chapstick that I have, I always keep. Their SPF has an orange cap, and so I just apply a little bit of that. Protect that bottom lip for sure. And then I spray my face. Like if I'm gonna go mow, which I love to mow, I spray my face, my whole body. I like spray cans instead of like the lotions. I don't know if one's better than the other as far as to spray or to lotion, but this is just easy and for me to apply and make sure I get full coverage. Again, the quality of product that you get, that's really up to you for how clean you want your sunscreen to be. I know we all see horror stories of pictures on Facebook with kids or adults that have gotten burns from a bad sunscreen. So that is for you to decide, you know, what you want to purchase. I've always had decent luck with the cheap stuff, and I feel like my liver can kind of take care of some of the chemicals. I think the benefits of sunscreen far outweigh the risk of cancers. So here we go. So I spray into my hairline and I rub it in. Spray, like you need to consider like your children or your spouse, if they have a receding hairline, spray into that. If your kids have braids or there's a distinct part, or the boys who are getting the actual part shaved in, spray the fire out of that. And then I usually spray, you know, my whole face and the tops of my ears. I'm not going outside right now, but that's that. I always wear a hat. This is one of my mowing bonnets. It's ridiculous, I know, but I like it because my head gets kind of hot sometimes when I mow, and this one covers my ears. It's got a really big visor. This kind of reminds me of that hat from The Sandlot, when he went to go play baseball, and they're like, what kind of hat is that? Anyways, it's got a big visor on it, so it really covers my nose really well and past my chin. So I wear this. Sunglasses always protect those crow's feet and our eyes. And so this would be how I would go outside. And then again, if I have a swimsuit on or whatever, I just spray whatever is showing, and I try to stay covered. But those are just a few of my tips for how to prevent sun damage, and why we should screen, how to screen for head and neck cancers inside the mouth and outside the mouth. Again, the best policy is if you ever see anything suspicious or that you don't know, is to get it checked out. The best time to get skin cancers and things like that, or lesions looked at, is when you're not tan. It's typically in the winter time. So thank you today for tuning in. I hope you learned a little something about screening yourself. Even as a clinician, we need to be doing this to ourselves and of course to our patients. Good luck. If you have any questions, post them below. Thank you for watching.